Have you ever noticed that someone can seem perfectly sharp for decades and then, almost suddenly, begin forgetting names, misplacing everyday items, or struggling to follow conversations they once handled effortlessly? Most families assume there's only one explanation. Aging, maybe Alzheimer's disease, maybe dementia, maybe it's simply part of getting older. But what if, in some cases, the explanation is sitting inside a medicine cabinet? What if a medication taken every day for years could be contributing to memory problems without anyone realizing it? The truth is that medications save lives every day. Many are essential. Many help people live longer, healthier lives. This video is not about fear, and it is certainly not about stopping medications on your own. It's about awareness, because research continues to show that certain medications may affect memory, attention, and cognitive function, particularly in older adults. And understanding those risks could help you have a more informed conversation with your healthcare provider. I'm Dr. James Walker, and today we're going to explore 9 commonly used medications and medication categories that researchers have associated with cognitive side effects in older adults. Stay with me until the end, because the final category isn't a single medication at all. It's something millions of seniors experience without ever hearing its name. And according to researchers, it may be one of the most important factors affecting brain health after 60. Let's begin. The first medication category often surprises people because it's available without a prescription. Many people keep it in their homes year-round. It's commonly used for allergies, colds, itching, and even sleep. I'm talking about first-generation antihistamines, particularly medications containing diphenhydramine. Many people know it by the brand name Benadryl. For younger adults, occasional use may not seem like a major concern, but as we age, the brain becomes more sensitive to certain chemical changes. Diphenhydramine belongs to a group of medications known as anticholinergics. These medications reduce the activity of acetylcholine, a neurotransmitter involved in learning, attention, and memory. Researchers have spent years studying how long-term exposure to strong anticholinergic medications may affect cognitive health. Some studies have found associations between higher anticholinergic exposure and an increased likelihood of cognitive decline in older adults. That doesn't mean Benadryl causes dementia in every person who takes it. Far from it. But it does mean that frequent long-term use deserves careful consideration. Many seniors take nighttime medications that contain diphenhydramine without even realizing it. Sleep aids, cold medications, multi-symptom formulas. The ingredient may appear under different brand names while producing similar effects. That's why reading labels matters. The next category involves medications many people take for acid reflux and heartburn. Proton pump inhibitors, often called PPIs, include medications such as omeprazole and esomeprazole. For people struggling with severe reflux, these medications can be incredibly helpful, but researchers have questioned whether long-term use may have unintended consequences. One reason involves vitamin B12. The body requires stomach acid to absorb B12 efficiently. Over many years, reduced stomach acid may contribute to lower B12 levels in some individuals. Why does that matter? Because vitamin B12 plays a critical role in nerve function and brain health. Low B12 levels can sometimes cause symptoms that resemble memory problems or cognitive decline. This doesn't mean everyone taking a PPI will develop a deficiency. Many won't. But it's one reason healthcare providers sometimes monitor nutrient levels in long-term users. The larger lesson here is that medications can influence the body in ways that extend beyond their primary purpose. A pill designed for the stomach may indirectly affect the brain through nutrient absorption, and that's why regular medication reviews are so important. Now let's talk about a category that affects millions of older adults. Bladder control medications. Overactive bladder can significantly impact quality of life. It can interfere with sleep, travel, social activities, and daily confidence. Medications such as oxybutynin are commonly prescribed to help manage these symptoms. The challenge is that many of these medications also possess anticholinergic properties. Just like some allergy medications, they may affect acetylcholine activity within the body. Researchers have investigated whether prolonged exposure to strong anticholinergic medications may influence memory and cognitive function over time. Several studies suggest a potential connection. This is particularly important because many people take these medications for years rather than weeks. What makes the situation complicated is that untreated bladder problems can also affect health and well-being. That's why the goal is never to stop treatment without guidance. Instead, it's about discussing risks, benefits, and possible alternatives with a qualified healthcare professional. Next comes a medication category that often generates debate: statins. These medications are among the most widely prescribed drugs in the world. They help lower cholesterol and reduce cardiovascular risk. For many people, statins provide substantial benefits, yet some individuals report experiencing memory issues or mental fog while taking them. Researchers have investigated these reports for years. The results have been mixed. Some studies have found little evidence of significant cognitive harm. Others have documented cases where symptoms improved after medication adjustments. The important takeaway is balance. Heart disease and stroke can profoundly affect brain health. Protecting cardiovascular health often protects cognitive health as well. That's why decisions regarding statins should always involve a healthcare professional who can weigh both risks and benefits. Now let's discuss a group of medications frequently prescribed for anxiety and sleep difficulties. Benzodiazepines. These include medications such as Xanax, Ativan, and Valium. Many people first experience these medications as life-changing relief. Anxiety decreases, sleep improves, stress becomes easier to manage. But researchers have expressed concerns about long-term use, particularly among older adults. These medications work by enhancing calming signals within the brain. Over time, however, they may contribute to sedation, slower thinking, reduced alertness, and memory difficulties in some individuals. Falls and balance problems may also become more common. For this reason, many experts recommend using the lowest effective dose for the shortest appropriate duration whenever possible. The conversation surrounding benzodiazepines isn't about fear. It's about understanding that medications affecting brain activity can sometimes influence cognition as well, and when changes occur gradually, they may be difficult to recognize. Imagine living in a room where the lights become 1% dimmer every week. You might not notice at first, but after several years, the difference could be significant. That's one reason periodic medication reviews are so valuable. Sometimes subtle changes become visible only when we step back and look at the bigger picture. Another medication category worth discussing involves certain older antidepressants. Some medications within this group have stronger anticholinergic effects than newer alternatives. Researchers have investigated whether long-term exposure to these medications may contribute to cognitive challenges in older adults. Again, context matters. These medications can provide meaningful benefits for depression, chronic pain, sleep disorders, and other conditions. No medication should be judged solely by potential side effects. Benefits matter too. The key is making informed decisions. Patients deserve to understand both sides of the equation. They deserve to know not only what a medication may help, but also what risks researchers continue to study, because informed patients make better healthcare decisions, and healthcare works best when doctors and patients work together. One of the most overlooked categories involves medications that many people never realize affect the brain. Certain medications prescribed for motion sickness, nausea, muscle spasms, or other seemingly unrelated conditions may also possess anticholinergic properties. This creates a hidden challenge. A person may take several medications. Each medication individually contributes only a small effect, but together, those effects accumulate. Researchers sometimes refer to this as anticholinergic burden. Think of it like carrying weights in a backpack. One small weight may not seem significant. Add another and another and another. Eventually, the load becomes difficult to ignore. The same principle may apply to medications affecting acetylcholine. Individually, the effects may appear modest. Combined, they may become more meaningful. This brings us to one of the most important points in today's discussion. Medication interactions aren't always dramatic. Sometimes they develop slowly over years. A person may not connect increasing forgetfulness with medications because the change happens gradually. Family members may assume it's simply aging. Doctors may focus on individual prescriptions rather than cumulative effects. And the connection remains hidden. That is why comprehensive medication reviews can be so valuable. A pharmacist or physician can evaluate all medications together rather than examining each one in isolation. Sometimes a small adjustment can make a meaningful difference. Sometimes an alternative medication may provide similar benefits with fewer cognitive concerns. And sometimes the review provides reassurance that current treatments remain appropriate. Either outcome is valuable because information leads to better decisions. Now let's discuss antipsychotic medications. These medications were originally developed to treat serious psychiatric conditions. However, they are sometimes prescribed for additional reasons, including certain behavioral symptoms. Researchers have documented concerns regarding their use among older adults, particularly when used outside carefully monitored situations. Potential risks may include sedation, cognitive changes, falls, and other complications. This is an area where individualized medical guidance is especially important because every situation is different and every patient's needs are unique. The final category is not a single medication. It is something researchers call polypharmacy. Polypharmacy simply means taking multiple medications simultaneously. For many seniors, this becomes increasingly common with age. A medication for blood pressure, another for cholesterol, something for sleep, something for allergies, something for digestion, something for pain. Before long, a person may be taking 10 or more medications every day. Each medication may be appropriate, Each may serve a legitimate purpose, but together they create complexity. Interactions become more likely, side effects become harder to identify, and the cumulative burden on the body increases. Researchers have repeatedly found that higher medication burden is associated with increased risk of adverse outcomes in older adults. That doesn't mean medications are bad. It means medication management matters, perhaps more than many people realize. The good news is that awareness creates opportunity. You don't need to memorize every medication category we discussed today. You don't need to become a pharmacist. You simply need to ask questions, review medications regularly, discuss concerns openly with healthcare providers, and remain curious about changes in memory, attention, and thinking, because cognitive health deserves the same attention we give to heart health, bone health, and physical fitness. The brain is remarkable, and protecting it often begins with understanding the factors that influence it. I'm Dr. James Walker. Thank you for spending this time with me today. If you found this information helpful, leave a comment below and tell me how many medications you currently take each day. Don't forget to like this video, subscribe to the channel, and turn on notifications for more evidence-based health content focused on healthy aging, brain health, and living well after 60. Take care of yourself, stay informed, and I'll see you in the next video.